You're getting ready to go on to Medicare and you want to be able to keep your doctors. So what I'm going to do in this video is I'm going to show you exactly what you need to do to make sure you see the doctors that you like. Let's begin this discussion by making sure that you are completely clear about your options when you go on Medicare. Now, first off, people are eligible for Medicare when they're first turning 65, and unless you or your spouse are working and covered by a group plan of 20 people or more, you have to go on Medicare at 65. And so when we make the decision to go on Medicare at 65 or at a later date, then there's only two ways in which we can use our Medicare benefits. One way is to stay in what we call the original Medicare A and B system, and that means that Medicare is going to be your first payer. Now, Medicare pays decently, but it doesn't pay for anything 100% other than preventive services. So whenever we have original Medicare A and B, we're always going to have a balance of the bill. That could be a deductible, it could be a copay, it could be coinsurance, but the balance of the bill is your responsibility. So what we do is we call those gaps. So Medicare pays first, but there's always a gap that you're going to be responsible for financially. So most people, what they'll do is then they will add to that coverage a Medigap policy. These are also called Medicare Supplemental Plans. Those are synonymous. And whenever we do that, of course, we're going to have to pay a premium for that insurance company to take that financial liability from us. About half of all people today that are getting private health insurance are using Medigap policies. All right. And so I'm going to explain how it relates to the doctors that are available to you in that particular system here in just a minute. But the point is, we have two ways to use our Medicare. We can use original Medicare A and B, pays first, a Medigap policy that's going to pay second. All right? So that's one system. The other system is to be enrolled in A and B, but we don't use original Medicare. We use what's called a replacement plan, and these are also called C plans or called Medicare Advantage plans. Now, these have not been around as long as supplemental plans and all, but they started back in 2003, so they've been around about 20 years now. But Medicare Advantage plans are an alternative to original Medicare. It's a private health insurance company that is replacing original Medicare for you. So when we go on Medicare, either at 65 or 69, whenever you start, we only have two options. We get A and B with a SUP, or we get a Medicare Advantage plan. And so then back to our question when it comes to doctors, depending on how you're going to use your Medicare will determine the answer to that question, can you keep your doctor? Okay, so let's do this first. Let's start with just talking about original Medicare A and B, and this is getting a supplemental plan. All right, so in this particular system here, number one, you have no networks whatsoever. No networks. That means that you can go to any hospital on the A side, any skilled nursing that takes Medicare. You can go to any doctor, any specialist, any surgeon, any doctor that takes Medicare. If you stay in original Medicare A and B, you have no network whatsoever. All right, so all you have to do is ask that provider, do you take Medicare? So let's say we have, we're going to see a doctor, we're going to the hospital, and so as long as that hospital or doctor takes Medicare, you're fine. And then they also have to take your Medicare supplemental plan that you choose. Now, most people are going with an F plan or a G plan or an N plan. There's 10 of them available, usually F, G, or N. And there are a variety of companies that offer those, United Healthcare and Aetna and Humana and Mutual of Omaha and Cigna. There's lots of companies. But the point is, you don't even have to ask that provider if they will take your supplemental plan at all, because if they take original Medicare, they will absolutely take your supplemental plan. Any company you've chosen, any letter that you've chosen for your supplemental plan, they have to take that. Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video. So we have no networks whatsoever in original Medicare, but we do have to find out, do you take Medicare? Because if that provider doesn't take Medicare, my opinion, I wouldn't go there. I just wouldn't, unless it's, some kind of a natural path or something you would see occasionally. But if I got some serious health issue going on and ongoing medical bills, I'm certainly want to go to providers that are taking original Medicare. So in this system, that's all you have to ask. Do you take original Medicare? Now, to that question, someone answers yes. There's actually 2 types of doctors, though, that actually take Medicare, and that would be those that are called participating. Now, what this simply means, a participating doctor participating doctor or hospital, whatever, is participating in what is called the fee for service. Okay, fee for service. And that means that Medicare covers thousands of services, and there's already a predetermined fee that provider, that hospital, that doctor, that specialist, that surgeon knows exactly what they're going to get paid. That's fee for service. And so about 90% of all doctors on the minimum are going to accept fee for service. So they know exactly what they're going to get paid for that surgery or that doctor visit or that orthopedic checkup or something. They know exactly what they're going to get. And so the majority of doctors participate in that. That is called what we would call an assignment doctor. An assignment. They agree to take Medicare reimbursement rates as payment in full. They don't add anything to the bill. And again, 90% of docs are going to do that. But there's some doctors, they say on average about 7 to 10%, that don't participate in the fee for service as payment in full. This is a non-assignment doctor. And what that doctor does is that doctor actually adds to the bill. And when they add to the bill, that is called an excess charge. All right. Now, there's a limit to excess charge. The most they can add is 15%. And whenever they add, I've never seen one that didn't add the full amount, so they can add up to 15%. So if they're going to, they'll add the 15%. And when that happens, you are responsible to pay for that. All right. And so, again, we asked, do you take Medicare? And then we can ask, do you take assignment? And most do, but some don't. Some actually are going to add excess. In fact, if you go to some of the specialty clinics, almost always, all the Mayos around the country, a lot of your cancer specialty centers are going to add excess. And the reason that matters is this. They can take Medicare, but if they add excess, now we got a 15% additional bill. And so what happens is the majority of people that are concerned about the possibility of going to Mayo or some of these especially places where they can add excess will actually get a supplemental plan that will cover excess charges. And there's actually only 2 that will do that. All right. And so, because remember, there's 10 supplemental plans on the market right now, but only 2 cover excess, and that's it. And those plans are Plan F and Plan G. Okay, now, the F plan is not available for most people. The F plan is being phased out, has been for a few years, but the only people that can actually have an F plan are anyone that were born before January 1st, 1955. That means they were eligible for Medicare before January 1, 2020. So those people can get an F plan. But if you're born after January 1st, 1955, starting Medicare after January 1, 2020, you can't get an F plan. So the only option for you to get excess charges covered would be to take a G plan. And frankly, that's my favorite anyways, because it's almost full coverage. F is full coverage. G is full coverage less once a year you have a B deductible. This year, that deductible is $226, 2023. Okay, but the whole point is you can get that excess charge covered. So back to our discussion. Can you see your doctor? Well, number one, you have to ask your doctor if they take Medicare, and if they do they take assignment? And or if not, you get a G plan, and then it's going to be covered anyways, even if they do have the excess charges. And maybe your doctor takes assignment now, but changes down the road. Well, that's why I think it's wise to go ahead and for a few extra dollars to go ahead and get a plan like the G that will actually cover excess charges in case this ever becomes an issue, or if your health changed and you have to go to a Mayo Clinic, because they're always going to add that 15%. And if you don't have a G plan, you would be out of pocket for that. All right. And so that's what we have to find out. Do they take Medicare? Now, let me just give you some practical advice about this. First off, here's what we find. About 99% of all doctors do take Medicare. But there are some doctors today that are not taking new Medicare patients. And again, some are, but some are not. And so, but what we find is that as long as our clients, as they're approaching Medicare eligibility, usually the doctor that they're seeing, as long as they already have a relationship with that doctor and now they're ready for Medicare, even if that doctor is not taking new Medicare patients, they will actually see their existing patients that are now new to Medicare. All right. In other words, if you already have that relationship, more than likely they're not going to drop you. I have seen a handful of doctors that won't take anyone in Medicare, but again, that's not the norm. But I have seen some that won't take new Medicare patients. So hopefully you have a good relationship. If not, you better be sure you establish one in case they won't take new Medicare patients. All right. So that's if you're in make the decision to stay in the original Medicare system with a supplemental plan. Medicare pays first, supplemental plan pays second. That's exactly the way it's going to work, and that's how you can know whether you can see your doctor or not, and then you'll know that you can get those extra charges covered as well through a supplemental plan. All right, and by the way, I got a lot of videos on this, and you can watch those, and as we break down the different gaps in Medicare and how to get those properly covered. All right, so now let's talk about the second system. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. So the first system was A and B with a supplemental plan. The second system, remember, these are these C plans. These are the replacement plans, also called Advantage plans, all right? And again, these have been out for about 20 years now. And so the difference is in this system, in fact, before I tell you the difference, let me just share this. There's only one item that supplemental plan A and B with supplemental plans and this Advantage plan system have in common. Just one item, and that is you have to be enrolled in Medicare A and B. So if I have a supplemental plan, I have to be in A and B. If I have an Advantage plan, I also have to be enrolled in A and B. All right, so that's the only thing these two systems have in common. Beyond that, they are totally different financially, different everything. Okay, and so let's talk about how we're going to answer that question about can you keep your doctor if you choose to have an Advantage plan. Well, here's the way Advantage plans work. Number one, this is a private health insurance company that has actually replaced Medicare for you, and the way they make these work is they put together a network of providers. Remember, if you stay with a supplemental plan, you don't have a network. They just have to take Medicare. But if I have an Advantage plan now, I have to find out they're going to take my plan because there are actually two types of plans. You have HMOs and you have PPOs. And every company that offers Advantage plans always offers both. Now, the difference is with the HMOs, what they normally do is financially, HMOs look a little bit more attractive because your copays are going to be lower. Your annual max out-of-pockets are going to be lower. It's usually cheaper to see a specialist or go to the hospital or to have an MRI. And so those financial packages are a little bit more attractive on the HMOs than the PPOs, right? But with that HMO financial package also comes some restrictions, and that's this. If you're on an HMO, you have to stay in your network of providers. You cannot go out of the network unless you're in an urgent care situation or an emergency situation. Then you can go out. But if it's not urgent or emergency, you've got to stay in that network, okay? And that network could be a little bit more limited, and so you got to be aware of that for sure, okay? And so that's the HMO network. Now, the PPO network, you can see by my box, it's bigger because more doctors participate in the PPO plans. Well, why is that? Because they get paid more. That HMO contract doesn't pay those doctors as much as the PPO. So what happens is some doctors won't take the HMO, but maybe they'll take the PPO plan. And so again, it's totally voluntary. Keep this in mind. A doctor does not have to take either one of these, and some of them don't take any of them. They may participate in original Medicare and choose not to participate in the Advantage system, and there's plenty that won't. They just don't like that system, so they don't participate. So when we talk about keeping our doctor, we have to decide first off, if I'm going to take an Advantage plan, am I going to be in an HMO network or am I going to be in a PPO network? And then, of course, then you have to call your provider. And again, there's some providers that take both. There's some that only take the PPO. There's some that take none of them. So we're going to have to find that out. So that's why we always tell people, if you're going to take an Advantage plan, we always start first with your providers. Can you see the doctors and go to the hospitals and those that you would like to see, especially like skilled nursing facilities? Sometimes those can be quite limited on the Advantage plans. Okay, so in this system, that's the big difference. We're going to have to check our networks, all right? And then what you have to also realize is that Advantage plans are only written for 1 year at a time. So I've seen this happen plenty of times. Doctors in the network this year, but there's something goes wrong and they're disgruntled about something and they pull out of the network and now they're no longer. Now you got to either change doctors or you're going to have to change networks. And so because those Advantage plans are only written for 1 year at a time. All right. And so when we talk about Advantage plans, you got to keep in mind that these are the plans that are what we call pay-as-you-go plans. So in fact, let me just show you just a quick little comparison here between these two plans. So let's talk about our doctors. So if I am on A and B with the supplemental plan, I'm over here on that C plan or that Advantage plan. Here's what's going to happen. Okay. The difference is here, remember, I have no networks. Here, I have an HMO or a PPO. If I'm using A and B with a supplemental plan, if I have a G plan, once a year, all I do is meet my B deductible. 2023, that's $226. And every doctor that I see after I have met my annual deductible will cost me $0. There's no cost whatsoever. As long as Medicare pays, once you've met your deductible, there will be nothing else out of pocket because that G plan that you purchase is going to cover those expenses for you. All right? And so that's the beauty of that. If I'm over here on this Advantage plan, what happens is Advantage plans have 0 premium for the plan. See, because remember, if I had that G plan, I had to pay a premium, a monthly premium, because I got rid of all the liability of all my expenses out of pocket other than my B deductible. On the Advantage plans, they don't charge a premium. You got to pay Medicare, of course, their part. But here you have 0 premium. Why? Because now I am going to pay as I go. Pay as I go. So usually what happens, primary care physician copays are usually 0. On most plans, at most it'd be $10, so very reasonable. If I see a specialist, it's going to be anywhere from about $30 to $50 to see that specialist. Okay, if I have an outpatient procedure, that may cost me $250 copay to be able to have that outpatient procedure. So the point is, I'm paying as I go until I hit what's called my max out of pocket for the year, which ranges on the HMOs right now anywhere from about $2,500 to probably $4,000. PPOs are going to be anywhere from about $4,000 to about $7,000. Okay, max out of pocket. Really? So what we're trying to show you is that depending upon as long as your doctor takes the plan, you're financially going to have some very reasonable copays, but you're going to just simply pay as you go until we hit the max out of pocket. If I'm over here in this system, if I have a G plan, I meet my B deductible once a year, and I'm telling you everything else is 0, 0, 0 all the way through. As long as Medicare pays, that G plan will pick up the difference. All right. So as we look at keeping your doctor, we got to first decide: are you going to stay in A and B with the supplemental plan because you like the features of that, or you can go an Advantage plan, and then we got to narrow that down to say, is it going to be an HMO network or a PPO? What's going to work best for you? And then what will be your out-of-pocket expenses as you pay as you go in that particular system? Okay, so I know how important it is to make sure that you keep your doctor. So the first decision, how you're going to use your Medicare. The second one then is going to be, what doctors can I see within one of those two systems that I choose?